most of the times they don't need 4,000 grafts. In some cases, we see even half the number of grafts can fill, or in some patients, even the transplant is not needed at all, and only the medicines can fill it. Yeah, so not just we, but I'm sure a lot of other clinics also get the same question, because I'm sure hair transplant is an important decision of anyone's life. They will inquire, that's very obvious. But the major problem here is when these patients inquire and we ask them to show their pictures or maybe come for assessment. So most of the times they don't need 4,000 grafts. In some cases, we see even half the number of grafts can fill, or in some patients, even the transplant is not needed at all, and only the medicines can fill it.
Yeah, that is why I don't understand why people go for one specific number and ask for the cost. There are so many other factors that should be taken into consideration and not just the number of grafts. What is the cost of this?
And there is one more confusion which we see, like if A clinic is saying you need 4,000, B is saying you need 5,000, C is saying 6,000. So people when inquire from different clinics, they calculate the average also. Okay, is there 4,000 bola? That other one said 6,000, and so average is like 5,000. So, but the problem is majority of the clinics, when these patients actually come for assessment, they need much less number of grafts, and none of the clinic actually told them that the number of grafts which we need to fill this area will vary according to the dose of medicine. None of the clinic.
This is because many people do not go in depth. They do not themselves realize the role the medicine can play. Or if they do know the role of the medicine, they still want to turn a blind eye to that. And that is what we want to bring into common knowledge, that medicines also play a big role in the results. And if you are getting a hair transplant done on the basis of like additional help from a medicine, in the end, the result will not be as good and you will feel cheated. So it is always important to realize the importance of medicine from the beginning and do not go for high dosage of medicine or full dosage of medicine if it is not required, if you do not have aggressive balding, and that should be an important thing to consider.
So one of the important facts here is ki, people have accepted in some cases, and especially more so we see this in the Western countries, the European countries, US, where they say, okay, finasteride is obviously part and parcel of it, and we need to sustain our existing hair, and for that 1 mg daily finasteride is US FDA approved. But the problem here is that there are studies which show that even 0.2 mg finasteride per day also works very well as far as sustenance of existing hair is concerned. So there is a difference between just sustenance. Would you call this sustenance of grafts, these pictures, or you will call this as a lot of hair growth? So the medicines are not just actually helping sustaining the hair, but it is actually causing a lot of hair growth, which can be more than the actual hair transplant. It can contribute up to 90% of the entire result. 10% is just coming through the transplant and 90% through medicine. Now, this creates a huge gap between expectation and reality.